Hello everyone, my name is Elena Riza. I work as a clinical psychologist in Baylor Black Sea Foundation, Romania. Today I will be talking about how telecounseling helps maintain employee productivity and patient reach in the context of COVID-19 pandemic for HIV patients in the clinic. Baylor Black Sea Foundation is an NGO with the public utility status, and it's part of a BPI network of clinics. Since 2001, the clinic offers integrated services, medical and psychosocial, for approximately 1,000 patients living with HIV in the county, in close partnership with the Infectious Diseases Hospital in Constanța. Our mission is to help the community develop effective services for the prevention and care of infectious and chronic diseases. And the health behaviors we target in the clinic are related to self-management of the disease, taking medication and treatment adherence, preventing HIV transmission, and reducing risks associated with substance abuse. During the COVID-19 curfew in Constanța, between March and May 2020, Baylor has implemented a new psychosocial service, telecounseling, which aimed to continue monitoring our patients enrolled in the clinic and meet their needs while upholding social distancing recommendations. This service is enabled by a platform connected to the electronic medical record database, and phone calls can be initiated directly from patients' records and facilitates updates of their psychosocial status. Every session had an average time of 30 minutes, and a particular introductory topic on COVID-19 has been added to each session at the beginning to assess knowledge, attitudes, and the behavioral risks. Here you can see the key activities for people living with HIV and AIDS between April and June. As you can see in the left, for most of our psychosocial interventions were via telecounseling. Some concerns regarding HIV and COVID that our patients expressed were access to the antiretroviral treatment, the higher vulnerability for SARS-CoV-2 infection, although this has not been confirmed, and there have only been 3 known cases of people living with HIV who have also tested positive for COVID. Another concern was the higher risk of severe symptoms and the impossibility of accessing medical services or getting in contact with their doctor. Some barriers we have seen: confusion regarding infection with the SARS-CoV-2 virus based on the intake of antiretroviral treatment, and the belief in conspiracy theories. The counseling session structure was similar to traditional in-person one, and it went from establishing the report to summarizing the outcome. The aim of these behavioral health intervention for patients was to develop and improve their abilities for self-management of the disease and preserve their health for as long as possible. This program started in March 2020, and it's still partly used in the present to reduce the time they spend in the clinic. For 2 months, we worked with 420 people living with HIV in 733 psychological sessions. 44% were formal psychological assessments, but we also had COVID-related aspects, and we discussed HIV-related counseling sessions. The gender was 50% were women, and 40% of them are living in rural areas. So in some cases, they have to travel up to 300 kilometers to access services. 99.5% of them prefer the telecounseling session because of the flexibility associated around their schedule, less costs, and increased confidentiality. We could answer to any GDPR concerns or data protection. Only 2 persons refused the telecounseling. The number of intervention was similar with the same period in 2019, yet the number of beneficiaries with psychosocial intervention was higher in 2020. Psychosocial interventions for people living with HIV were successfully delivered remotely, It's a valid alternative to ensure patient follow-up and clinic staff productivity. Also, we ensure social distancing requirements, and the team productivity was maintained constant. We offer mixed services in the present, in person and remotely, to ensure an easier contact with our patients. You can follow us on social media, as you can see. Thank you very much.
Hello everyone, my name is Yuan Chao Ma. Today I'm going to be talking about Marvin, our chatbot. This is a new project we started this year that attempts to use artificial intelligence to engage HIV patients in their antiretroviral therapy. Nowadays, we sometimes still find it difficult to involve HIV patients in resolving issues relating to their health, or sometimes we are unable to respond to their requests as quickly as possible due to the unavailability of healthcare professionals. And this may cause anxiety or jeopardize patients' ability to follow their treatment as prescribed. Meanwhile, with this COVID-19 situation, these shortcomings are further reviewed, and there is a need to develop alternative sources of information or a kind of tool for our patients that could be accessed remotely. As a result, our team began to consider the use of chatbots as a solution, and we found that they have been shown to be cost-effective, to reduce adherence-related barriers, and to promote patient problem-solving skills in several studies. Examples include the Vic for chatbot for breast cancer in France and the Woebot for mental health issues in the States. Therefore, our goal was to design, develop, and test a chatbot to promote HIV patients' engagement and self-management on perceived potential ART adherence barriers. And we named it Marvin, stands for Minimal ARV Interference. And based on our previous findings, we considered two case scenarios for the first phase, which included providing advice for taking ART and for traveling with HIV. So we had a multidisciplinary team guiding the development of Marvin by using a co-design methodology, and the development consists two parts. So for the content development, we first created a corpus of HIV-related questions and answers by working with experts, patients from our patient committee, and also eventually with our healthcare providers. And you can see the figure on the left, which shows the everyday language expressions and questions we collected from our patients. And then we use afterwards these potential user inputs to train our chatbot. And on the right side is a conversation between a developer and one of our pharmacists. They are determining the best decision model for the chatbot in order to well direct the conversation with the users. So the next part is the technology development. And we worked with a group of engineering students from École Polytechnique de Montréal, led by two engineers. And they developed the chatbot based on Rasa, which is a well-known chatbot development platform with its powerful engine for natural language processing and conversation management. We then chose Facebook Messenger as the user interface for our first pilot test, and now we are considering applying it to the mobile application Opal, which is a patient portal that McGill University Health Center currently offers for cancer patients. We are trying to adapt it for HIV patients to use with our chatbot in the future. So now I'm going to show you a quick demo of how Marvin works, and it's currently available in both English and French, and here we converse with him in English. And we also implemented a couple of chat features to make conversations smoother. You can see here the two examples, what can you help me with, and also I have a question now. So let's say, okay, I don't remember my pill name, I have my pill with me, but I don't know what it is. And with the decision model we implemented, Marvin will ask me, okay, what's the imprints you see? And I give him, okay, it's GSI, and then he sent me the name is Complera, and also a picture of Complera just to verify with me if it's the good pill. And then I asked my second question, can I cut my Complera? Here I typed CON instead of COM, but you see Marvin still recognized the good pill and give me the right answer. And now I asked him this question. I was late with my computer. What should I do? And he asked me, okay, how long? Then I said 2 hours. And since I was 2 hours late, he gave me his answers. And also, once he knows I am still detectable for my viral load, he asked me to keep my medication schedule as closely as possible. And also, he gave me the option of set a reminder so that which shows his desire for help. So as a result, we can see that Marvin provides answers immediately and securely, thus enabling patients to independently address questions related to their ART treatment. And also, in addition, it automates functions that previously required face-to-face communication, thus saving time for both patients and healthcare professionals. And then it frees caregivers from repetitive tasks so they can have more time to spend with patients who have complex health issues. And with Marvin, we can also look at the patient's questions that Marvin can't answer, which will help position the chatbot for further developments to address new challenges faced by patients. So that's all for my today's presentation. If you have any questions, please contact my email here. Otherwise, thank you all for listening.